Did you know that 80% of adults will experience back pain at some point in their lives, and that rehabilitation professionals, including physiotherapists, are in higher demand than ever? If you're preparing for the OET exam, working in rehabilitation, or simply looking to improve your medical English, mastering the right vocabulary is crucial. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. Today, we're diving into 50 essential healthcare vocabulary terms, with a focus on physiotherapy, movement, and rehabilitation. This lesson comes from a student member request. And if you're a student member of Learning English Pro, your requests get priority. Plus, you'll get a handy downloadable guide with each lesson. The one for this lesson includes all the vocabulary from this lesson, fun exercises to test your knowledge, and links to additional medical English guides from Learning English Pro. If you want access to these exclusive materials, the link to join is in the video description. This is episode 2 of my healthcare vocabulary series, but don't worry if you missed episode 1, it's included directly in this video, so just keep watching. And that's not all. I've stacked additional relevant lessons for physiotherapists, private trainers, and rehabilitation professionals right into this video. You'll find timestamps in the description, allowing you to choose the topics that matter most. Whether you want to actively learn, find a quiet place and think about how to apply the language in your work, or you prefer passive learning, listening while going about your day, I've got you covered. Alright, enough business. Let's get started with 50 key healthcare vocabulary terms for physiotherapy. We'll cover pronunciation, form, meaning, and context, just like a real Cambridge English lesson. Let's begin. First up, we're going to look at nouns relating to physiotherapy. And our first term is joint stability. Repeat after me. Joint stability. This term refers to the ability of a joint to maintain proper alignment during movement. Let's take a look at our example sentence. Joint stability is essential for athletes to prevent injuries during sports. Let's move on to our next term, which is muscle atrophy. Muscle atrophy. Muscle atrophy is the wasting away or decrease in muscle mass due to inactivity. Extended bed rest can lead to muscle atrophy, making rehabilitation more difficult. Tendinitis. Tendinitis. This is the inflammation of a tendon, often caused by repetitive motion. The runner developed tendinitis from overtraining without proper rest. Let's move on to myofascial release. Repeat after me. Myofascial release. This is a therapy technique used to relieve muscle tightness and pain. Myofascial release techniques can help reduce tension in tight muscles. Our next term is gait analysis. Gait analysis. This is the study of a person's walking pattern to detect abnormalities. Let's check out our sentence example. Gait analysis showed that the patient was favoring one leg after surgery. Our sixth noun is ergonomics. Ergonomics. Ergonomics is the science of designing workspaces to reduce strain and injury. Good ergonomics in the workplace can prevent chronic back pain. Prosthesis. Repeat after me. Prosthesis. A prosthesis is an artificial body part, such as a limb or joint replacement. After losing his leg in an accident, he was fitted with a prosthesis. Let's move on to orthotics. Orthotics. Orthotics are custom-designed inserts or devices to support and align the feet. She wears orthotics in her shoes to support her arches and prevent pain. Our next term is balance board. Balance board. A balance board is a tool used in therapy to improve stability and coordination. The therapist recommended using a balance board to improve coordination. Spinal alignment. Spinal alignment. This refers to the correct positioning of the spine to prevent pain and injury. Spinal alignment is crucial for reducing chronic back and neck pain. Compression bandage. Compression bandage. A compression bandage is a tight wrap used to reduce swelling and support injured areas. The doctor applied a compression bandage to control the swelling. Kinesiology tape. Kinesiology tape. This is a flexible tape used to support muscles and reduce pain. Kinesiology tape helps support the athlete's knee during recovery. Neuroplasticity. Neuroplasticity. This refers to the brain's ability to reorganize itself by forming new connections. Neuroplasticity allows stroke patients to regain lost motor functions. Our next term is TENS, which stands for transcutaneous electrical nerve stimulation. And this refers to a device that uses electrical impulses for pain relief. The patient uses a TENS machine to manage chronic pain in his lower back. Biomechanics. Biomechanics. Biomechanics is the study of human movement and mechanics. Let's look at our example sentence. Biomechanics helps us understand how different movements affect the body. Rehabilitation Center. Rehabilitation Center. This is a medical facility focused on recovery from injury or surgery. He spent 3 months in a rehabilitation center after his knee surgery. Soft tissue therapy. Soft tissue therapy. This is a treatment that involves manipulation of muscles and tendons. Soft tissue therapy reduced the tension in his shoulders and neck. Motor control. Motor control. Motor control is the ability to regulate and direct movement. Motor control exercises helped the patient regain movement in his arm. Let's move on to bursitis. Bursitis. This is an inflammation of the fluid-filled sacs that cushion joints. Bursitis in her shoulder made lifting heavy objects painful. Our 20th noun is the term scar tissue. Scar tissue. Scar tissue is thickened fibrous tissue that forms after an injury or surgery. Scar tissue formed after the surgery, affecting her range of motion. Well done, that's 20 nouns relating to physiotherapy and movement. And next up, we're going to take a look at some verbs relating to physiotherapy and movement, so get ready. All the definitions I give will be in the context of physiotherapy and movement. The first verb we will look at is mobilize. Mobilize. Mobilize means to move a joint or muscle to restore function. And let's take a look at our example sentence. The therapist mobilized the patient's stiff ankle to improve flexibility. Strengthen. Strengthen. Strengthen means to build up muscle power and endurance. Resistance exercises help strengthen weak muscles after an injury. Let's move on to retrain. Retrain. And this word means to teach a body part to function again after injury. The patient had to retrain his walking pattern after a stroke. Contract. Contract. As a verb, contract means to tighten a muscle actively. He was instructed to contract his abs during the exercise. Stabilize. Stabilize. In physiotherapy, to stabilize means to make steady or maintain proper alignment. Bracing techniques help stabilize her injured knee. Activate. Activate. This means to engage a muscle group during movement. The exercise activates the glutes and improves lower body strength. Realign. Realign. This word means to restore correct positioning of bones or joints. The chiropractor realigned his spine to relieve pressure on the nerves. Next up, we have elongate. Elongate. This word means to stretch or lengthen a muscle. Stretching helps elongate muscles and improve flexibility. Rehabilitate. Rehabilitate. This word means to restore strength and function after an injury. The clinic specializes in rehabilitating sports-related injuries. Engage. Engage. To engage means to actively use a muscle group. Engaging the core is crucial for proper posture during exercise. Next up, we have loosen. Loosen. And this means to reduce stiffness or tightness in muscles or joints. Massage therapy helped loosen tight muscles in his back. Reprogram. Reprogram. This means to train the nervous system to adapt to new movement patterns. Stroke patients need to reprogram their nervous system for movement recovery. Reinforce. Reinforce. This means to strengthen a movement or posture through repetition. The therapist reinforced proper walking techniques through repetition. Optimize. Optimize. To optimize means to improve efficiency and effectiveness in movement. Optimizing movement patterns can enhance athletic performance. Prevent. Prevent. To prevent means to take steps to avoid injury or deterioration. Wearing proper footwear can prevent ankle injuries. That's all the verbs we're going to cover. Next, let's move on to some adjectives relating to physiotherapy and movement. Our first adjective is weight-bearing. Weight-bearing. And this term describes something supporting body weight while standing or moving. Weight-bearing exercises strengthen bones and muscles. Our next term is the opposite of weight-bearing. Non-weight-bearing. Non-weight-bearing. This adjective can be used to describe an injured limb which has to avoid any pressure. After surgery, he was on a non-weight-bearing protocol for 6 weeks. Pain-free. Pain-free. We use this term to describe when one is without any discomfort or pain. She was relieved when her knee became pain-free after treatment. Progressive. Progressive. We use this term to describe when something like an injury or condition increases in difficulty or intensity over time. Let's check out our example sentence. The therapist used a progressive approach to increase exercise intensity. Isolated. Isolated. We use the term isolated when something like an exercise is targeting a specific muscle or movement. Isolated muscle exercises target specific weak areas. Controlled. Controlled. This term describes when something is done with precision and focus. Controlled movements help prevent injuries during rehabilitation. Unstable. Unstable. Unstable describes a situation or maybe a person's movement which is lacking balance or stability. An unstable surface forces the body to engage stabilizing muscles. Compensatory. Compensatory. Compensatory is used to describe situations where adjusting movements are made to make up for a weakness. Compensatory movements can indicate muscle imbalances. Inflamed. Inflamed. If something is inflamed, it is swollen and painful due to an irritation. Her wrist was inflamed after overuse at work. Restricted. Restricted. In physiotherapy, we can use restricted to describe a patient who is limited in movement or range of motion. The cast made her ankle movement restricted. Let's move on to optimal. Optimal. Optimal describes the best possible condition for function or recovery. The patient reached an optimal recovery state after months of therapy. Symmetrical. Symmetrical. Symmetrical is used to describe when conditions are even and balanced on both sides of the body. A symmetrical gait is important for proper walking mechanics. Overactive. Overactive. We use overactive to describe a person or perhaps muscles which are working excessively, often leading to strain. Overactive muscles can cause tightness and discomfort. And next we have the opposite of overactive, underactive. Underactive. And similarly, this describes a person or maybe muscles which are not working enough, and it can lead to muscle weakness. An underactive glute can lead to poor hip stability. Our final adjective and final word for this lesson is resilient. Resilient. To be resilient is to be able to recover quickly and adapt to movement. A resilient mindset helps patients recover faster from injuries. Well done, you've just learned 50 essential healthcare vocabulary terms focused on physiotherapy, movement and rehabilitation, a huge step in improving your medical English. Student members, don't forget to download your guide packed with all the terms, exercises and links to additional resources. If you're not a member yet but want to access, click the link in the video description. But don't go anywhere. As promised, I've lined up the next part in my healthcare vocabulary series and it's coming your way right now. Keep watching to continue building your medical English skills. Today, we're exploring 50 essential healthcare terms with the focus on mental health. Mental health is a critical part of patient care in all healthcare contexts. Whether you're a psychologist, a therapist, nurse, doctor, or any professional working with patients, this lesson is packed with valuable vocabulary you'll use every day. For each of the 50 terms, you'll perfect your pronunciation, understand the meaning, and get real-life professional context with example sentences. This is a complete Cambridge-style English lesson designed to help you master meaning, form, and pronunciation for professional use. To take your learning even further, I've created a useful downloadable guide with all the vocabulary plus exercises for this lesson. It's available exclusively for my student members on the membership tab. Want access? You can join today and unlock this PDF plus so much more. The link to join is in the video description. Alright, enough business. Let's get straight into our 50 essential healthcare terms for mental health. Our first set of words focus on diagnostic terms. Our first word is neurodivergent. Repeat after me. Neurodivergent. This adjective describes individuals whose neurological development and functioning differ from societal standards of normal. Let's take a look at our example sentence. The patient identifies as neurodivergent, exhibiting traits consistent with autism spectrum disorder. Let's move on to bipolar disorder. Bipolar disorder. This is a mental health condition characterized by extreme mood swings, including manic and depressive episodes. The patient has been diagnosed with bipolar disorder and is currently experiencing a manic phase. Next up is schizophrenia. Schizophrenia. This word describes a severe mental disorder involving distorted thinking, perceptions, and a diminished ability to function. Early intervention is crucial in managing schizophrenia to improve long-term outcomes. Next up, we have obsessive-compulsive disorder, better known as OCD. This disorder is characterized by unwanted recurring thoughts or obsessions and repetitive behaviors or compulsions. Let's check out our example sentence. Cognitive behavioral therapy is effective in treating patients with obsessive-compulsive disorder. Another common disorder is post-traumatic stress disorder, better known as PTSD. This is a condition triggered by experiencing or witnessing a traumatic event, leading to severe anxiety and flashbacks. The veteran was diagnosed with PTSD following his return from active duty. Our next batch of words deals with symptomatic terms. Anhedonia. Repeat after me. Anhedonia. This noun describes an inability to experience pleasure from activities usually found enjoyable. The patient's anhedonia is a significant barrier to engaging in therapeutic activities. Affective flattening. Affective flattening. This term describes a reduction in the expression of emotions, often seen in facial expressions and voice tone. Affective flattening was observed during the mental status examination. Let's move on to our next term, hypervigilance. Hypervigilance. This is an enhanced state of sensory sensitivity and exaggerated awareness of surroundings. Hypervigilance in the patient suggests underlying anxiety issues. Our next word is rumination. Rumination. Rumination is the act of continuously thinking about the same thoughts, often negative, which can contribute to depression. Let's check out our example sentence. Addressing rumination is essential in the cognitive therapy of depression. Psychomotor agitation. Psychomotor agitation. This term describes unintentional and purposeless motions stemming from mental tension and anxiety. The patient's psychomotor agitation has decreased with the new medication regime. Our next topic is treatment-related terms. Psychopharmacology. Psychopharmacology. This is the study of the use of medications in treating mental disorders. Let's check out our example sentence. Advancements in psychopharmacology have improved outcomes for patients with mood disorders. Let's move on to cognitive behavioral therapy, better known as CBT. This is a type of psychotherapy that helps patients identify and change negative thought patterns and behaviors. CBT has been effective in reducing symptoms of anxiety and depression in adolescents. Next up, we have electroconvulsive therapy, also known as ECT. This is a medical treatment involving electrically induced seizures to treat severe mental disorders. ECT is considered when patients with severe depression do not respond to medication. Next up, we have mindfulness-based stress reduction, also known as MBSR. This is a therapeutic approach combining mindfulness meditation and yoga to reduce stress. MBSR programs have been integrated into treatment plans for patients with chronic anxiety. Let's move on to dialectical behavior therapy, also known as DBT. This is a form of therapy designed to help individuals manage intense emotions and reduce self-destructive behaviors. DBT is particularly effective for patients diagnosed with borderline personality disorder. Our next section deals with descriptive terms used in mental health care. Euthymic. Euthymic. This adjective pertains to a normal, stable mood state, neither depressed nor manic. Let's check out our example sentence. The patient has remained euthymic for several months with ongoing treatment. Let's move on to labile. Repeat after me. Labile. In mental health, labile describes emotions characterized by rapid and unpredictable changes. The patient's mood was labile, shifting from tears to laughter within minutes. Our next term is dysphoric. Dysphoric. Dysphoric is used to describe when a patient is experiencing a state of unease or generalized dissatisfaction. The patient reported a dysphoric mood throughout the past week. Psychosomatic. Psychosomatic. This term relates to physical symptoms caused or aggravated by mental factors. Stress can lead to psychosomatic symptoms such as headaches and stomach aches. Somatic. Somatic. And this adjective describes symptoms relating to the body, especially as distinct from the mind. The patient presented with somatic complaints, including fatigue and muscle pain. Our next batch of words relate to common behavioral terms used in mental health care. If you've been affected by any of the terms covered, please make sure to seek help from a professional. Self-harm. Self-harm. This is the act of deliberately inflicting pain or injury on oneself. The patient has a history of self-harm but denies any recent incidents. Suicidal ideation. Suicidal ideation. This is the presence of thoughts about or planning suicide without necessarily making an attempt. The patient reports experiencing passive suicidal ideation, but denies any intent or plan to act on it. Addiction. Addiction. Addiction is a compulsive dependency on a substance or behavior, often leading to harmful consequences. The patient's addiction to opioids has led to significant health complications. Compulsion. Compulsion. A compulsion is a repetitive, irresistible urge to perform a behavior, often linked to OCD. Hand washing has become a compulsion for the patient, interfering with daily activities. Delusion. Delusion. A delusion is a firmly held, false belief that is resistant to evidence or logic. The patient exhibits delusions of grandeur, believing they have supernatural abilities. Hallucination. Hallucination. This is a sensory perception that occurs in the absence of an external stimulus, often auditory or visual. Auditory hallucinations are a common symptom in schizophrenia. Derealization. Derealization. This is a feeling of detachment from one's surroundings, as if the external world is unreal. During periods of high anxiety, the patient experiences derealization, experiencing the world as dreamlike. Disassociation. Disassociation. This is a mental process where a person disconnects from thoughts, feelings, memories, or identity. The patient disassociates during stressful events, reporting memory gaps and emotional numbness. Hyperfixation. Hyperfixation. An intense and prolonged focus on a specific interest or activity, often linked to ADHD or autism. The patient describes hyperfixation on video games, leading to neglect of personal hygiene. Codependency. Codependency. Codependency is a behavioral condition where one person enables another's addiction or unhealthy behavior. The therapist is working with the patient to establish boundaries in their codependent relationship. Emotional dysregulation. Emotional dysregulation. This is difficulty managing emotional responses appropriately. Patients with borderline personality disorder often struggle with emotional dysregulation. In our next section, we're going to take a look at common mental health verbs. Diagnose. Diagnose. To diagnose is to identify a medical condition based on symptoms and tests. The psychiatrist diagnosed the patient with generalized anxiety disorder. Medicate. Medicate. To medicate is to administer medication as treatment. The patient was medicated with an SSRI to manage depressive symptoms. Prescribe. Prescribe. This verb means to authorize the use of specific medication or treatment. The doctor prescribed an antidepressant to help regulate mood. Stabilize. Stabilize. This word means to bring a patient's condition to a steady, controlled state. The goal is to stabilize the patient's mood swings through therapy and medication. Let's move on to regress. Regress. To regress is to revert to a previous, less advanced state of mental or emotional well-being. After discontinuing therapy, the patient showed signs of emotional regression. Suppress. Suppress. This word means to reduce or inhibit a mental or emotional response. The medication helps suppress intrusive thoughts in patients with OCD. Our next term is to cognitively reframe. Cognitively reframe. And this means to shift perspective on a thought or belief to reduce stress. Cognitive reframing is a key technique in treating negative thought patterns. Disclose. Disclose. To disclose means to reveal or share personal information, often in a therapeutic setting. The patient was hesitant to disclose past trauma, but gradually opened up. Reinforce. Reinforce. To reinforce means to strengthen a behavior or thought pattern, either positively or negatively. Therapists use positive reinforcement to encourage healthy coping strategies. Validate. Validate. To validate is to acknowledge and affirm someone's emotions or experiences. It's important to validate the patient's feelings before offering solutions. In our final section, we're going to take a look at medications and therapy-related terms used in mental health care. First up, we have SSRI, or selective serotonin reuptake inhibitor. This is a class of antidepressants that increase serotonin levels in the brain. Let's take a look at our example sentence. SSRIs, like fluoxetine, are commonly prescribed for depression and anxiety disorders. Anxiolytic. Anxiolytic. An anxiolytic is a medication that reduces anxiety. The patient was prescribed an anxiolytic to manage panic attacks. Mood stabilizer. Mood stabilizer. A mood stabilizer is a type of medication that helps balance mood fluctuations, often used in bipolar disorder. Lithium is a widely used mood stabilizer for bipolar disorder. Neuroleptic. Neuroleptic. Neuroleptic is another term for antipsychotic medication used to treat conditions like schizophrenia. Neuroleptics can help manage symptoms of psychosis but may have side effects. Exposure therapy. Exposure therapy. Exposure therapy is a psychological treatment that involves gradual exposure to anxiety triggers to reduce fear. Exposure therapy has been highly effective for patients with phobias. Trauma-informed care. Trauma-informed care. This is an approach that recognizes and responds to the impact of trauma in patient care. Trauma-informed care ensures that the patient feels safe and respected in therapy. Somatic therapy. Somatic therapy. Somatic therapy is a therapeutic approach that focuses on the connection between mind and body in processing trauma. Somatic therapy techniques, like grounding exercises, help patients reconnect with their bodies. Psychosocial intervention. Psychosocial intervention. This is a non-medical approach to improving mental health through social and behavioral strategies. Group therapy is a common form of psychosocial intervention. Mindfulness meditation. Mindfulness meditation. This is a practice that involves focusing on the present moment to improve mental well-being. Mindfulness meditation is integrated into therapy to help manage stress and anxiety. Holistic psychiatry. Holistic psychiatry. This is an approach that combines conventional psychiatry with alternative and complementary methods. Holistic psychiatry considers lifestyle, diet, and emotional well-being alongside medication. Well done, you've just completed this lesson on 50 essential healthcare terms for mental health. This is just the beginning. There's so much more to learn in the Healthcare Vocabulary series. So if you found this lesson useful, subscribe and turn on notifications so you don't miss the next episode in the series. Have you ever struggled to find the right way to describe an injury in English? Maybe you know the everyday term, but not the precise medical name, or vice versa. Or perhaps you're preparing for the OET exam and want to sound more confident when discussing patient injuries. Well, in this lesson, I've got you covered. Hi, my name is Jer, and this is Learning English Pro, the channel that helps healthcare professionals like you excel in English and advance in your careers. Today's lesson is perfect for physiotherapists, nurses, doctors, and anyone studying for the OET. We're covering 50 essential injuries and physical conditions, from sprains and fractures to dislocations and ruptures, all explained in clear professional English. Student members can access a handy guide for this lesson in the Membership tab. It includes everything from today's video, plus exercises like my AI-generated homework to help you practice and remember what you learn. Here's how the lesson will work. I'll give you the most commonly used term for the injury, then we'll go over the proper medical name. Next, I'll explain the condition with a clear, concise definition. You'll also see visuals to help you fully understand the term. Finally, we'll look at an example sentence using natural collocations, so you'll learn the right way to talk about these injuries in a real-life medical setting. This lesson packs in a lot of information, so choose how you want to learn. Active learners, watch the full lesson in a quiet, focused space. Take notes with a pen and paper and think about which terms you're most likely to use in your work. And let me know in the comments which injuries you encounter the most. For passive learners, play this video in the background while you go about your day. This is a great way to absorb English naturally without needing to sit down and study. Alright then, let's get started. Our first condition is a broken bone. The medical term for this is a fracture. Let's take a look at our first definition. A broken bone or a fracture is a break in a bone, which may be minor, like a hairline fracture, or severe, like a compound fracture. And let's take a look at our example sentence. The X-ray confirmed that he has a fractured wrist, and he'll need a cast. Let's move on to dislocated shoulder. And the medical term is quite similar, shoulder dislocation. Our definition is when the upper arm bone or the humerus comes out of its socket. Our example sentence, he fell off his bike and dislocated his shoulder, requiring immediate treatment. Third on our list is a sprained ankle, also referred to as an ankle sprain. This is defined as a stretched or torn ligament in the ankle. She twisted her foot while running and now has a sprained ankle. Let's move on to pulled muscle. This can also be referred to as muscle strain or strained muscle. It is an overstretching or tearing of muscle fibers. Let's take a look at our example sentence. He lifted a heavy box and ended up with a strained back muscle. Our fifth term is bruise. The medical term for this is contusion. The definition is a bleeding under the skin due to a blunt injury. After falling on the stairs, she developed a large bruise on her thigh. Our next condition is a swollen knee. In medical terminology, this is known as a knee effusion. It is a fluid buildup in or around the knee joint due to injury or inflammation. His knee is swollen after the accident, and the doctor suspects ligament damage. Let's move on to a torn ligament. You can tear a ligament in lots of different places. One common type is known as an ACL tear. It is a tear in the ACL, which of course is a ligament in the knee. Our example sentence is, the footballer was sidelined for months after an ACL tear. Let's move on to torn cartilage. There is cartilage in different parts of the body. One common type of torn cartilage is a meniscus tear. This is damage to the cartilage in the knee, often caused by twisting. He needed surgery to repair a torn meniscus. Our ninth term is a cracked rib. In medical terminology, it would be known as a rib fracture. This is a break or crack in one of the ribs, usually caused by trauma. She has a cracked rib from the car accident, but it will heal on its own. Let's move on to frozen shoulder, also known in medical terms as adhesive capsulitis. This is a stiffness and pain in the shoulder joint, leading to limited movement. Let's take a look at our example. He developed frozen shoulder after months of inactivity. Our next condition is sports-related, a tennis elbow. Also known as lateral epicondylitis. It is an inflammation of the tendons in the elbow due to overuse. His doctor diagnosed him with tennis elbow from repetitive lifting. A similar condition is golfer's elbow. This is known as medial epicondylitis, and it is an inflammation of the tendons on the inside of the elbow. Let's take a look at our example sentence. The patient complained of pain due to golfer's elbow. We are already on our 13th term, which is a slipped disc. In medical terms, this would be known as a herniated disc. And it describes a spinal disc that is moved out of place, pressing on nerves. He has a herniated disc causing severe back pain. Next up, we have whiplash. This is also known as cervical strain. It describes a neck injury caused by sudden back and forth motion, often from car accidents. After the car crash, she suffered from whiplash. Let's move on to concussion. In medical terms, this could be called a mild traumatic brain injury, or an MTBI. This is a temporary loss of brain function due to a head injury. Let's take a look at our example. The boxer was taken to the hospital with a concussion. A common injury is a black eye, also known in medical terms as a periorbital hematoma. This is a bruising around the eye due to impact. He got a black eye after being hit in the face. Our 17th condition is a burst appendix. In medical terms, it might be called a ruptured appendix. This is a life-threatening condition where the appendix bursts, leading to infection. She was rushed to surgery for a ruptured appendix. Let's move on to collapsed lung, medically known as pneumothorax. This is where air leaks into the chest cavity, causing the lung to collapse. A severe injury caused a collapsed lung, requiring immediate treatment. Next, we have a gunshot wound. In medical terms, it might be called a ballistic trauma. And of course, this is an injury or a wound caused by a bullet or firearm. The patient arrived with a gunshot wound to the shoulder. A deep cut is another condition, also known in medical terms as a laceration. This is a deep tear or cut in the skin. The kitchen knife accident left him with a deep laceration on his hand. Let's move on to a burn, or in medical terms, a thermal burn. This is damage to the skin caused by heat, fire, or chemicals. The chef suffered a second-degree burn from boiling water. A similar condition is sunburn. This is also known as radiation burn, and this is skin damage caused by excessive UV exposure. After a day at the beach without sunscreen, she got severe sunburn. Our next condition is the opposite of sunburn, frostbite. And frostbite is what it would be known as in medical terms. This is tissue damage caused by extreme cold, leading to numbness and discoloration. Let's take a look at our example. The hiker developed frostbite on his fingers after being stuck in the snow. Let's move on to a nosebleed, in medical terms, epistaxis. This is bleeding from the nose due to injury or dry air. He had a nosebleed after getting hit in the face during the game. Next up, we have knocked out tooth, known medically as an avulsed tooth, and this is where a tooth has become completely dislodged from its socket. The boxer had a knocked out tooth and needed immediate dental care. Another common dental condition is a chipped tooth, known medically as a dental fracture. This describes a small break or crack in a tooth. She bit into a hard candy and ended up with a chipped tooth. Condition number 27 is a split lip. In medical terms, it's known as a lip laceration, and this describes a deep cut or tear in the lip. He fell off his bike and ended up with a split lip. Next up, we have stab wound. This can be known medically as a penetrating trauma and describes a deep wound caused by a sharp object. Our example is, the paramedics treated a patient with a stab wound to the abdomen. Let's move on to punctured lung. This can also be called a traumatic pneumothorax. It describes a lung injury where air leaks into the chest cavity. The patient had a punctured lung due to a fractured rib. We are already at number 30, internal bleeding. In medical terms, this would be called a hemorrhage, and it defines bleeding inside the body, often due to trauma. Let's take a look at our example. The car crash victim showed signs of internal bleeding and needed surgery. Next up, we have a swollen lip. In medical terms, this would be called a lip edema. It describes a swelling of the lips due to something like an injury or an allergy. After the allergic reaction, his lip was swollen and painful. Next, we have sprained wrist, or a wrist sprain. This is a stretched or torn ligament in the wrist. She slipped on ice and ended up with a sprained wrist. A jammed finger can also be called a finger sprain. This is an injury to the ligaments in the finger due to impact. He jammed his finger playing basketball and now it's swollen and stiff. Let's move on to the nicely named turf toe. Better known in medical circles as metatarsal phalangeal joint sprain. This describes a sprain of the big toe. It's common in athletes. And our example sentence is, The footballer was sidelined with turf toe after a rough tackle. Our next condition is one I have suffered with myself: shin splints. Medically, it is known as medial tibial stress syndrome. It describes a pain along the shin bone due to overuse. The new runner develops shin splints from training too hard. An Achilles tendon tear is also known as an Achilles tendon rupture. It describes a complete tear of the Achilles tendon, which connects the calf to the heel. He collapsed in pain after an Achilles tendon rupture during a sprint. Number 37 is a rotator cuff tear, also known as a rotator cuff injury. It describes a tear in the muscles or tendons of the shoulder. The swimmer was diagnosed with a rotator cuff tear and needed physical therapy. Let's move on to a boxer's fracture. In medical terms, a fifth metacarpal fracture. This is a fracture of the hand bones, often caused by punching a hard object. He broke his hand in a fight and was diagnosed with a boxer's fracture. Next up, we have groin strain, also known as adductor muscle strain. This describes an overstretching or tearing of the muscles in the groin area. Let's take a look at our example. He had to stop playing due to a groin strain. Let's move on to blister. This can also be known as a friction blister. It is a fluid-filled bubble on the skin caused by friction or burns. She developed blisters on her feet from wearing new shoes. The term bed sores can also be referred to as pressure ulcers. These are skin wounds caused by prolonged pressure, common in immobile patients. The nurse treated the elderly patient's bed sores with special dressings. Next, we have ear barotrauma. In medical terms, this would be known as barotitis media. It describes damage to the ear due to sudden pressure changes. He experienced ear barotrauma while scuba diving. Our next term is dehydration. In medical terms, it can also be known as hypohydration. And of course, this is a condition where the body loses too much fluid. The marathon runner suffered from severe dehydration. Our next type of injury is an electric shock. You might hear this referred to as an electrical burn or electrocution, and it's defined as an injury caused by contact with electricity. Let's take a look at our example. The worker was rushed to the hospital after an electric shock. Condition number 45 is a broken nose, also known as a nasal fracture. This is a break or crack in the bones of the nose, often caused by impact. The rugby player suffered a broken nose after a head collision. Let's move on to a hip fracture. In medical terms, a femoral neck fracture, and this describes a break in the upper part of the thigh bone. The elderly woman needed surgery after a hip fracture. Compartment syndrome, or acute compartment syndrome, describes pressure in a muscle area, cutting off circulation. Let's take a look at our example. The patient needed emergency surgery for compartment syndrome. Our next injury is an eye scratch. In medical terms, this could be known as a corneal abrasion. It describes a scratch on the eye's surface, causing pain and redness. The doctor prescribed eye drops for his corneal abrasion. Number 49 is a blood clot. There are lots of different types of blood clot. Today we'll cover deep vein thrombosis, or DVT. DVT is a clot in a deep vein, usually in the legs. He was diagnosed with deep vein thrombosis after a long flight. Our final condition is seizure injury. known as a postictal injury in medical terms. This is a trauma caused by uncontrolled body movements during a seizure. Let's take a look at our final example. He bit his tongue due to a seizure injury and required medical care. Well done, you've made it to the end of this lesson, and that's a huge achievement. Learning medical English takes time and practice, and you're doing great. To get the most out of this lesson, I recommend repeating the lesson. Repetition is key to remembering new vocabulary. Practice the terms by saying them out loud or writing them in sentences. Share this lesson with a colleague or friend and have a chat about it. This is a great way for both of you to improve your English around this subject. Are you a physical therapist learning English and struggling to find the right words when speaking with patients? Maybe you know exactly what you're doing clinically, but explaining exercises, giving encouragement, or answering patient questions in English feels like a challenge. If so, this lesson is for you. Hi, I'm Jer and welcome to Learning English Pro, the channel where healthcare professionals improve their English communication skills and build confidence in their careers. In today's lesson, we'll cover 50 essential phrases for physical therapists. These phrases will help you explain exercises, guide treatments, and connect with your patients in a clear and professional way. Good communication isn't just helpful, it's essential for patient care. Research shows that clear communication improves treatment success, builds trust, and helps patients recover faster. However, as a physical therapist learning English, you might find it difficult to explain complex instructions or encourage patients with the right vocabulary. Many patients might not speak your first language, and that can make every interaction feel even harder. That's why this lesson focuses on key phrases physical therapists need to know in English. These are simple, practical phrases that you can use every day to feel more confident and effective. To help you even more with this lesson, I've created a downloadable guide for my student members. It includes all 50 phrases from this video, 2 interactive exercises to practice, and a glossary of 20 key physical therapy terms. Use it with the video to build your confidence through repetition and regular practice. If you want to join the student membership on my channel, just click the link in description. There are lots of perks to help you boost your English learning. This lesson was actually inspired by one of my student members, Tatiana, who recently requested a video specifically for physical therapists and rehabilitation specialists. Thank you, Tatiana, for your suggestion. It's always great to create lessons tailored to your needs, and as a student member, your requests get priority. In our first category, we will look at phrases related to initial assessment. Can you tell me where you're feeling pain? This phrase highlights the importance of understanding the patient's specific pain points, helping to focus the assessment and treatment plan. When did the pain start, and has it changed over time? With this question, we're emphasizing the timeline of the issue, which can provide clues about the injury or condition. Have you had any previous injuries or surgeries in this area? This phrase ensures we're gathering the patient's medical history to avoid complications and provide tailored care. Can you describe how the pain feels? Sharp, dull, throbbing, or something else? Here we're encouraging the patient to give detailed descriptions, which can aid in diagnosing the issue more accurately. Does the pain get worse with certain movements or activities? This is a great phrase for identifying triggers and understanding the patient's functional limitations. Let me know if anything I do causes discomfort. With this sentence, we ensure the patient feels comfortable communicating during the assessment. Let's move on to our second category, which is patient education. This exercise targets the muscles that support your spine. Here we educate the patient about the purpose of a specific exercise. Good posture can help reduce your pain over time. This phrase highlights the benefits of maintaining proper posture. Strengthening this area will improve your overall stability. With this sentence, we're explaining the functional benefits of targeted strengthening. Using ice packs can help reduce inflammation after exercises. This phrase provides actionable advice for managing discomfort at home. Regular stretching can prevent stiffness and improve flexibility. This is a great way to emphasize the importance of incorporating stretching into daily routines. Moving right along to our third category, which is treatment instructions. Let's start with some gentle stretches to warm up your muscles. This phrase introduces the session and sets the tone for a gradual and safe start to treatment. I'll guide you through this movement. Try to copy me as closely as you can. Here we're emphasizing clarity and patient engagement by providing a visual and verbal guide. Remember to breathe evenly while doing this exercise. This is a great reminder for patients to stay relaxed and avoid holding their breath during exercises. Let's focus on improving your range of motion in this area. With this phrase, we explain the goal of the exercise, keeping the patient informed and motivated. If you feel any sharp pain, stop immediately and let me know. This phrase highlights the importance of safety and open communication during treatment. Keep your movements slow and controlled to avoid straining the muscles. This sentence emphasizes proper form and minimizes the risk of injury. You might feel some discomfort, but it shouldn't be painful. This phrase sets realistic expectations for the patient during the session. Let's adjust this exercise to make it more comfortable for you. This is a great phrase for personalizing the treatment and showing empathy. Hold this position for 5 seconds, then slowly release. Here we are providing clear and actionable instructions for a specific exercise. We're already on our fourth category and it's a nice one: how to give encouragement and feedback to patients. You're doing great. Keep it up. With this phrase, we're reinforcing the patient's efforts and boosting their confidence. Let's try that movement again, but with a little less force. This is a constructive way to provide feedback and refine the patient's technique. You're making excellent progress. I can see an improvement already. This phrase helps keep the patient motivated and reassures them of their progress. It's okay to take a break if you need to. This phrase emphasizes the importance of pacing and listening to the body. Great job! You've really improved your balance since last time. With this sentence, we're recognizing and celebrating the patient's achievements. There are always challenges with treatment, and in our fifth category, we have some great phrases to deal when issues pop up with patients' treatment. Let's modify this exercise to suit your current range of motion. With this phrase, we show flexibility and adaptability in treatment. If this position is uncomfortable, let's try an alternative approach. This phrase ensures the patient feels supported and understood. It's normal to feel frustrated, but every small step counts. This is a great way to acknowledge the patient's emotions and keep them motivated. We can adjust the intensity based on how you're feeling today. With this sentence, we're prioritizing the patient's well-being and comfort. Recovery takes time, but you're on the right track. This phrase reassures the patient and fosters patience during the process. With our sixth category, we're going back to some more encouraging English with some great motivational phrases. Each session brings you closer to your goals. With this phrase, we're keeping the patient focused on their progress. The effort you're putting in now will pay off in the long run. This is a great way to encourage persistence and long-term thinking. Remember, small improvements add up over time. This phrase motivates the patient to appreciate gradual progress. You're stronger than you think. Let's keep going. With this sentence, we provide a boost of confidence to the patient. You've got this. I'm here to help you every step of the way. This phrase reinforces the therapist-patient partnership and trust. We're almost at the end of our lesson. Our second last category is very important: safety and precautions. Let's make sure your movements are safe and within your limits. This phrase emphasizes the importance of safety during exercises. If you're feeling dizzy or lightheaded, stop immediately and let me know. With this sentence, we ensure the patient knows how to respond to unusual symptoms. Be mindful of your posture when lifting objects at home. This is a great way to provide practical advice for daily activities at home. We'll avoid any movements that could strain your injury further. Here we're showing care and caution in tailoring the treatment plan. Use a support or brace if you feel unstable during activities. This phrase offers a helpful suggestion for maintaining safety and confidence. Can you believe we're on our last category already? These handy phrases will be useful when you're closing the session with the patient. Let's finish with some light stretches to cool down. This phrase helps transition from active exercises to a more relaxed state. How do you feel after today's session? With this question, we're encouraging patient feedback to gauge the session's success. Make sure to drink plenty of water after this session. This phrase emphasizes self-care and helps prevent soreness or fatigue. You've worked hard today. Well done. This phrase acknowledges the patient's effort and ends the session on a positive note. I'll see you at your next appointment. Keep practicing the exercises we went over. This is a great way to reinforce the importance of consistency in the patient's progress. You're making great progress. We'll build on this next time. With this sentence, we set a positive tone for future sessions. Don't hesitate to reach out if you have any questions before your next appointment. This phrase encourages ongoing communication and trust. You should be proud of the effort you put in today. This phrase ends the session on an uplifting note, fostering confidence. Consistency is key. Keep up the good work. With this sentence, we encourage the patient to stay committed to their recovery. Take care, and I'll see you next time. This is a friendly and professional way to close the session. Well done, and thank you for watching this lesson on English for physical therapists. I hope these 50 essential phrases will help you feel more confident in your patient communication and make a real difference in your daily interactions. If you're a student member, don't forget to download the guide that comes with the lesson. It includes everything we covered today, plus 2 exercises to practice the phrases and a glossary of key physical therapy terms. Repetition is key, so I recommend using the guide alongside the video to reinforce your learning. To join my student membership, click the link in the video description. If you enjoyed this lesson or found it helpful, please let me know in the comments. I'd also love to hear about your experience. Have you tried any of these phrases with your patients yet? For more healthcare Are you ready to boost your English skills and get fit at the same time? Stay with me because today we're diving into 30 essential fitness phrases that will have you speaking like a fitness pro in no time. Hi, I'm Jer and welcome back to Learning English Pro, where I help you improve your English fluency with practical lessons for real life situations. Today's lesson is perfect for anyone, whether you're a physiotherapist, a personal trainer, or just someone who loves hitting the gym. These phrases are designed to be useful across the fitness world. And today we're going to treat English like a workout. We'll be breaking down the meaning and form of each phrase, showing you how to use them in real life situations, and of course, perfect your pronunciation. For my student members, there's a huge guide that accompanies this lesson, packed with additional practice and exercises. You can find it under the membership tab. If you haven't joined yet, click the link in the video description to sign up and get access to all my exclusive lesson materials. Alright then, let's get started and build your English fitness together with 30 phrases for exercise and fitness. In our first category, we are looking at preparation for exercise, with phrases relating to warm-up and stretching. Stretch your arms overhead. Here, stretch means to lengthen or extend a muscle. The direction overhead tells you to reach above your head, helping you to warm up your shoulders, arms, and upper back before any workout. Let's take another listen. Stretch your arms overhead. Let's move on to our second phrase. Loosen up your shoulders. Loosen up is a phrasal verb meaning to relax or gently prepare muscles. Tight shoulders can restrict movement, so this phrase ensures you're ready to exercise without discomfort. Loosen up your shoulders. Rotate your hips in circles. Rotate means to move something in a circular motion. The hips are a crucial joint for movement, and rotating them helps improve flexibility and prevent stiffness during exercise. Rotate your hips in circles. Let's move on. Bend forward and touch your toes. Bend refers to the act of leaning your upper body forward. This stretch targets your hamstrings, calves, and lower back, all critical areas to prepare for physical activity. Bend forward and touch your toes. Take deep breaths while you stretch. Take deep breaths is an important part of stretching, as it helps you relax and improves oxygen flow. Trainers use this to help you ease into stretches without tension. Take deep breaths while you stretch. Our second topic of phrases relates to heart-boosting activities like cardio and aerobic exercises. Pick up the pace for 30 seconds. Pick up means to increase, and pace refers to speed. This phrase is commonly used during interval training to get your heart pumping and build endurance. Pick up the pace for 30 seconds. Jog in place to get your heart rate up. Jog in place means running without moving forward. This is a common warm-up exercise that helps elevate your heart rate and prepare your body for more intense cardio. Jog in place to get your heart rate up. Our next phrase is, keep your arms pumping while you run. Pump here means to move your arms quickly back and forth. This action adds momentum to your run and engages your upper body for a more effective workout. Keep your arms pumping while you run. Let's move on. Maintain a steady rhythm as you cycle. Maintain means to keep something consistent. A steady rhythm refers to pedaling at a smooth, even pace, ensuring your workout is effective and controlled. Maintain a steady rhythm as you cycle. Cool down with a slow walk. Cool down means to gradually reduce your heart rate after exercise. A slow walk allows your muscles to relax and prevents dizziness. Cool down with a slow walk. Our next set of phrases all relate to building muscle and endurance with strength training. Lift the dumbbells slowly and with control. The verb lift means to raise something, and the phrase with control is a reminder to avoid fast, uncontrolled movements that could lead to injury. Lift the dumbbells slowly and with control. Bend your knees as you squat. Bend means to form a joint angle. In this case, bending your knees helps lower your body into the correct squat position, which targets the thighs and glutes. Bend your knees as you squat. Our next phrase is push the barbell overhead in a smooth motion. Here, push refers to applying force to move something upward. When paired with barbell, this phrase targets upper body strength and shoulder muscles. Push the barbell overhead in a smooth motion. Grip the pull bar tightly for stability. Grip means to hold firmly. When doing pull-ups, a tight grip is essential for maintaining balance and control. Grip the pull-up bar tightly for stability. Brace your core as you lift heavy weights. Brace means to tighten or prepare. This phrase reminds you to engage your abdominal muscles to protect your back during weightlifting. Brace your core as you lift heavy weights. Our next topic is all about range of motion and relates to flexibility and mobility training. Stretch your hamstrings by bending forward. Stretch means to lengthen a muscle. Hamstrings are the muscles along the back of your thighs, and this movement helps prevent stiffness and improves flexibility. Stretch your muscles by bending forward. Hold the stretch for 20 seconds. Here, hold means to maintain a position without moving. Trainers emphasize holding a stretch to allow muscles time to relax and lengthen. Hold the stretch for 20 seconds. Rotate your arm in circles. Rotate involves circular motion. Arm rotations warm up the shoulders and improve mobility. Rotate your arms in circles. Extend your leg straight behind you. Extend means to straighten or lengthen. This movement activates the leg muscles and improves balance. Extend your leg straight behind you. Align your back before starting the stretch. Align means to position properly. Maintaining correct alignment ensures safe, effective stretching and reduces the risk of injury. Align your back before starting the stretch. Our next batch of phrases relate to everyday movement training. It's all about functional fitness. Lift the heavy box using your legs, not your back. Lift means to raise or pick up. Trainers often use this phrase to teach proper lifting form, preventing strain on your lower back by using leg strength instead. Lift the heavy box using your legs, not your back. Carry the kettlebell close to your body. Of course, carry means to hold or move an object. Keeping the kettlebell close to your body helps maintain balance and control. Carry the kettlebell close to your body. Twist your torso while holding the medicine ball. Twist refers to rotating the upper body. This exercise targets the oblique muscles and improves core strength. Twist your torso while holding the medicine ball. Let's move on. Shift your weight to one side during lunges. Shift means to move from one position to another. In this case, it's about transferring weight to maintain balance during exercises like lunges. Shift your weight to one side during lunges. Maintain balance as you step onto the platform. Maintain means to keep steady. Functional fitness often includes movements requiring balance, such as stepping up onto elevated surfaces. Maintain balance as you step onto the platform. Our last batch of phrases relate to post-workout care, recovery and cool down. Relax your muscles and let them recover. Here, relax means to release tension. Post-exercise relaxation allows muscles to recover and grow stronger. Relax your muscles and let them recover. Our next phrase is hydrate with water to aid muscle recovery. Hydrate is a critical term in fitness, meaning to drink enough fluids. Water supports muscle repair and prevents dehydration. Hydrate with water to aid muscle recovery. Roll out your calves using a foam roller. Roll out means to apply pressure using a rolling motion. Foam rollers help massage muscles, reducing soreness and tension. Roll out your calves using a foam roller. Ease into the stretch to avoid injury. Ease into means to move gradually. Stretching too quickly can cause strain, so this phrase is a gentle reminder. Ease into the stretch to avoid injury. Take deep breaths to help your heart rate return to normal. Take deep breaths means to inhale deeply and exhale slowly. This technique calms the nervous system and aids recovery. Take deep breaths to help your heart rate return to normal. Well done, you've completed this lesson on 30 essential fitness phrases. By now, you should feel more confident using these phrases in a gym, during training, or even in casual conversations about exercise. Student members, don't forget to download the comprehensive guide for this lesson from the membership tab. It's packed with extra exercises to help you practice what you've learned today. And don't go. Hello and welcome back to Learning English Pro. In this video, we're delving into the world of cardio exercises or cardiovascular exercises, exploring various methods to boost your heart health and overall fitness. Let's dive straight into our first term, cardiovascular. The term cardiovascular refers to anything related to the heart and blood vessels, particularly the circulatory system. It encompasses activities, exercises, and conditions that have an impact on the health and function of the heart and blood vessels. Cardiovascular exercises specifically focus on activities that elevate the heart rate and increase blood circulation, promoting cardiovascular health and endurance. These exercises are crucial for maintaining a strong heart, improving lung capacity, and enhancing overall fitness. So let's take a look at some of the exercises recommended for cardiovascular activity. And the first one is jogging. Jogging is a moderate intensity aerobic exercise that involves running at a steady, comfortable pace. It's great for beginners and helps improve cardiovascular endurance over time. Running is a high-impact aerobic exercise where you move at a faster pace than jogging. It boosts lung capacity, burns calories, and enhances cardiovascular health. Let's move on to cycling. Cycling is a low-impact exercise, unlike running, that can be done outdoors or on stationary bikes. It strengthens leg muscles, improves stamina, and provides an effective cardiovascular workout. One of my favorite exercises is swimming. Swimming is a full body workout that engages various muscle groups. It's gentle on joints and enhances lung capacity while improving heart health. An exercise that reminds me of being a child is jump rope. Jumping rope is a fun and efficient way to raise your heart rate. It enhances coordination, strengthens calf muscles, and offers a fantastic cardiovascular challenge. Another fun exercise is dancing. Dancing combines cardiovascular exercise with creativity. It improves coordination, balance, and cardiovascular endurance while making workouts really enjoyable. Rowing is a full body workout that targets multiple muscle groups. It's excellent for cardiovascular health, muscle toning, and calorie burning. Aerobics or aerobic exercise include movements like jumping jacks, side steps, and kicks. They enhance heart and lung function while increasing overall stamina. Our final cardiovascular activity is kickboxing. Kickboxing combines cardio and strength training. It improves cardiovascular fitness, coordination, and helps in stress relief. Hello and welcome back to Learning English Pro. In today's video, we'll be exploring a comprehensive English vocabulary word list relating to gym equipment. If you're looking to expand your gym-related vocabulary, you're in the right place. Let's dive into the world of gym-related nouns. Our first piece of gym equipment is the treadmill. A treadmill is a stationary exercise bike with a moving platform or belt that allows users to walk, jog, or run in place. It is commonly used for cardiovascular workouts, helping to improve stamina, burn calories, and enhance overall fitness. Treadmill. Let's move on to dumbbells. These are handheld weights used for strength training exercises. They come in various weights and sizes and are used to target specific muscle groups. Dumbbell. Similar to a dumbbell, we have a barbell. This is a long metal bar with weights attached to both ends. It's commonly used in weightlifting and strength training exercises. Barbell. Our next piece of equipment is the elliptical. This can be also known as an elliptical trainer or cross trainer, and it's a stationary cardio machine that simulates activities like stair climbing, walking, and running without causing excessive impact on joints. Elliptical. Moving on to the rowing machine. This is an exercise machine that simulates the motion of rowing a boat. It provides a full body workout, engaging muscles in the arms, legs, back, and core. Rowing machine. A bench is a piece of gym equipment used for various strength training exercises. It typically consists of a flat or inclined surface where users can sit or lie down while performing exercises like bench presses, dumbbell flies, and lots more. Bench. A mat or an exercise mat, often referred to as fitness or yoga mat, is a padded, cushioned, and non-slip surface designed to provide comfort and support during various workout routines and stretching exercises. Mat. A kettlebell is a cast iron weight with a handle resembling a kettle with a spout. It is used for dynamic and functional exercises that involve swinging, lifting, and moving the kettlebell to engage multiple muscle groups and improve strength, flexibility, and coordination. Kettlebell. Next up, we have resistance bands. These are stretchable bands made of rubber or latex that provide resistance during strength training exercises. They come in various resistance levels and can be used to target specific muscle groups. Resistance bands. A stationary bike, also known as an exercise bike, is a stationary cardio machine that mimics the motion of cycling. It provides a low-impact workout that targets the lower body muscles. Stationary bike. Our next term is the pull-up bar. This is a horizontal bar that is often mounted to a wall or frame. It is used for upper body strength exercises like pull-ups and chin-ups, which primarily target the muscles of the back, shoulders, and arms. Pull-up bar. A medicine ball is a heavy ball, often made of rubber, that is used for strength and conditioning exercises. It can be lifted, thrown, or slammed to engage various muscle groups and improve power and coordination. Medicine ball. A leg press machine is a gym equipment used for leg strength training. Users sit on a seat and push a weighted platform away from them using their legs. It primarily targets the quadriceps, hamstrings, and glutes. Leg press machine. And a cable machine is a piece of gym equipment that consists of adjustable cables and handles. It allows users to perform a wide range of exercises by adjusting the height, angle, and resistance of the cables. Cable machine. A yoga block is a prop used in yoga practice to provide support and stability. It is often used to modify yoga poses and stretches, especially for practitioners who need assistance in reaching the floor or achieving proper alignment. Yoga block. A foam roller is a cylindrical tool made of foam that is used for self-myofascial release. It is rolled along different muscle groups to alleviate muscle tension, improve flexibility, and enhance recovery. Foam roller. A jump rope is a rope used for cardiovascular workouts and improving coordination. It involves jumping over the rope as it passes under your feet, providing an effective and fun way to engage in aerobic exercise. Jump rope. Our next term is the stair climber. This is an exercise machine that simulates stair climbing for cardiovascular fitness. It provides a low-impact workout that targets the lower body muscles. Stair climber. Let's move on to the squat rack. This is a piece of gym equipment used for performing squats and other compound exercises. It consists of upright posts with adjustable safety bars that support the barbell during exercises. Squat racks are essential for safely lifting heavy weights. Squat rack. Last but not least, we have the punching bag. This is a heavy bag made of durable material used for boxing and martial arts training. It is punched, kicked, and struck to practice techniques, build strength, and improve cardiovascular endurance. Punching bag.